If you're postmenopausal and suffering from pelvic pain, there is relief in sight. Dr. Burt Webb with Scottsdale Center for Women's Health is here with some answers. Good morning, doctor. Always great to see you.
Morning.
You are a leading expert in women's health. Tell me, these postmenopausal women, what are you seeing them for?
A lot of different problems, but primarily hormones, where they feel tired or not as good as they think that they can feel. Hair loss, pain, leaky bladders. Big thing is, as far as bleeding, a lot of postmenopausal will have bleeding and they're told that's okay, or you have fibroids, so it's okay. And that's not accurate at all. We do ultrasounds with all the visits, and we're able to diagnose a lot more problems and actually tell them why they're having the problem and usually correct it without doing surgery.
You do a lot of second opinions. Why are these so important?
They're important because a lot of people are given information, a lot of patients are given information by their physician, and there's a lot of newer information. So I specialize in just gynecology. I don't do OB anymore. I can really devote all my time to this, learning about new ideas, new ways of treating problem. So I can give women information about what their problem is, how to take care of it, usually without doing surgery. But a lot of women go along and they have problems, bleeding, and they just think everything's okay.
And it's not. And as you specialize in this pelvic pain, what are some of the causes that contribute or make women so painful down in the pelvic area?
There are a lot of different reasons why women will have pain, and it starts from younger women. And a lot of times they're told, well, that's normal, or your mother had that too, so just live with it, or take Advil. And they don't have to. There can be everything from fibroids that can cause it, and it's really important to follow fibroids. I just saw a lady yesterday, and she was followed for a fibroids, and now it was so big that she had to have a big incision. She had complications from it. It was really too bad. Could have been treated in a much more conservative fashion. Endometriosis is often just overlooked, and they're put on birth control pills. As women age, they can have heavy bleeding problems. They can have bladder issues. There's some new areas that can cause problems that I specialize in, and a lot of these things are treatable without doing surgery.
And as you were saying earlier, a lot of doctors tell their patients, and a lot of women, I think, too, think this, you know what, I'm just going to deal with it. I'm going to live with the pain. I don't want surgery. Right. And you can help them with that because they don't have to live with the pain.
Right. They don't have to live with it. There are conservative ways. And in addition, they're told they have pain or a problem, and they have to have surgery. So that's where the second opinion is helpful, and just really educating women about new ideas, new techniques that can be used to make their lives better.
And as you were saying, you specialize in this, and you're doing a lot to make sure that, and to help women feel younger and function better. Is there anything new coming up?
There's some new things. Just besides hormones, there's new ideas about hormones. A lot of the older information has been misinterpreted. I do a lot of below-the-belt work to help women. A lot of women don't want to or not able to take hormones, and so their personal areas are not as good as they were when they were 20 or 30. And so there's a lot of ways of helping them, and that's one of the areas I specialize in.
To help them feel and function better, and you don't have to live with the pain. Doctor, thank you so much. Always great to see you. I always learn so much.
Thank you.
If you'd like more information on Scottsdale Center for Women's Health, visit their website, scottsdalewomenshealth.com, or call the number you see on your screen.